it's Dr. Porter from Wrinkle Free MD Med Spa and Wellness Clinic here in Austin, and we're going to talk about lip filler today. Tracy, my office manager nurse, has these beautiful lips, but we have a special going on for new people that are new to Brilliant Distinctions. They get $75 off any Juvederm product to put anywhere in their body, but lips are probably one of the most common areas that women desire to have augmented. But lips also have a bad reputation because they can be overdone, which is not something that we focus on here. My lips are done and they're just more even, they're a little bit more hydrated, but I don't think anybody would ever know that I have my lips done. So it's really, really important to understand anatomy and to understand ratios and what a normal aesthetic of a lip looks like before you do them. So you can click, we'll put the link of how to save $75, and it's a coupon that you sign up for. So we're going to be using Allergan, and we have 4 different products that we could use for the lips. So we're going to use Juvederm Ultra, which is just sort of the basic workhorse, and that's a great one for the lip. It's kind of your all-around lip filler. If somebody needs a little bit more structure, like they need some more filtral column definition, or they need their vermilion border well defined, this has a little bit more cohesivity, so it's a little bit thicker filler, so it provides a little bit more structure. Tracy has actually an amazing filtral column here and a really, really nice Cupid's bow, so we don't need the Ultra Plus. Volbella is a smaller syringe, and it's really for hydration. The syringes are about half the size as what a regular Juvederm syringe is, but it really just kind of hydrates, and I think we're going to give her a little bit of volume too. And then the last one is Juvederm Velour, which is the cross-linking is the same as Volbella. It's a little bit thicker, but it's great. I love this one for tear troughs, but I still just like Juvederm for the lips. I think I'm probably not in the minority of that just likes Juvederm for lips, just plain old Ultra. And then the other thing is we always have on hand a kit in case we could have an accident. I've never had to use any of this stuff because there was an arterial occlusion, but that's why you should go to somebody who knows their anatomy and, more importantly, knows how to recognize a complication, because you can cause an arterial occlusion and cause necrosis of somebody's face that can be long lasting. You can cause blindness if you're not sure what you're doing, and more importantly, again, if you don't recognize. So this is nitropaste, which is what we put on people when they're having chest pain and they have arterial blockages. So if I were to have some blanching or have evidence that maybe I had a problem with an artery, I could put some of this on the area to try to increase blood flow. I've got aspirin. I've got Hylenex, which is an enzyme that will help dissolve all 4 of these fillers that I'm using, and I always carry enough vials to be able to handle whatever complication I could have. And the third thing is just a pretty little vibrator that will help, if I had an occlusion, could help break apart the occlusion inside the artery and help it pass more easily. So go to somebody, I don't care where you go, if I'm not your jam, that's fine, but go to somebody that they can prove to you that they have ways to make sure that whatever they're doing for you is safe. It's filler. You shouldn't be, you shouldn't be dying or going blind over having your lips done. At least that's my opinion. So what we're gonna do, we did a block already. I did a block here to block the superficial branch here up on her upper lip. I always do that, and then she's still got full movement of her face though, so smile for me, Tracy. So it's not like a dental block, it's just a sensory block. It doesn't affect the motor, and then we put some numbing cream on. So I'm just gonna go and kind of trace her beautiful vermilion border here and kind of turn this little part of her lip out a little bit. She might bleed a little bit, she might bruise a little bit, and that's kind of normal. And normally I would have music on in here and kind of have it a little bit where it would be a little bit more relaxing. I'm sure she's probably nervous. She's never had this done before, and it's a needle in your face. You do feel it. But the Juvederm does have lidocaine in it, and so it's not as bad, I think, as what you think. As you go along, when you tend to hit the same spots, it doesn't hurt as much because you kind of already have that lidocaine in there. So I'm just gonna kind of trace her border. Just puff her up a little bit. And I like to work side to side. So I usually go, and then I go across from the side. I go down like this. And that's the spot that kind of hurts the most. The block doesn't work quite as well there. And I go back and forth from side to side rather than doing one side and then doing the other side. So if you're gonna have lips done, you might wanna not take any ibuprofen or aspirin for a few days beforehand. You might wanna abstain a little bit from alcohol if you drink fairly regularly. All those things can make you bruise more and make you bleed more. And that's the one thing, is you just never know whether somebody's gonna bruise. And I've had my lips done a few times by the same person, so I know the technique was the same, but sometimes I bruised and sometimes I didn't. So Anyway, this is only 1/5 of a teaspoon of filler. It's a little bit more than 1 ml, and there's 5 mLs in a teaspoon, so it's not very much. And if you use it right, it can be very, very powerful. But if you use it wrong, it can also be very, very powerful. So you just have to make sure that you place it. And I'm only at 0.08, so I haven't even used hardly any of it yet, just tracing and outlining her vermilion border. So that's usually where I start. It'll turn it out just a little bit and give them a little bit of definition. I think it kind of acts like a wall to sort of keep the filler in wherever else I'm putting it. Turn this out just a little bit. Okay. So hardly any of it. How are you feeling, Tracy?
I'm feeling good.
Good. Okay.
This is not bad.
It's not as bad as you thought. That's what everyone always says. So then you have these little wrinkles, and then you have the mucosa on the inside. So then I usually will next go right in there, and they call that the wet to dry border, and I'll go under the body of the lip, and I'll just kind of put a little bit of filler in the body of the lip on both sides to plump it up a little bit. She didn't have any asymmetry, so I didn't have to worry about that. If somebody has asymmetry, I first kind of try to correct their asymmetry before I do anything else. You just have to make sure you're in the right plane, or you can see the filler and you'll get lumps. You might get a little bumpy or swelly for a little bit, a couple days, and then usually you can massage it and it evens out. So. It doesn't take a whole lot, and honestly, I probably won't even need or use the whole syringe for her. So we can always find somewhere else. We were talking about her nasolabial folds. She has almost minimal here, and she has a little trace here, so that might be where I would put it. So we don't save filler because you can get biofilms on it, and you can end up getting infections. And so I don't save the filler. So when you buy it, you pay for the syringe, but we can always find somewhere else to put it. And you never really know how much it's going to take, but I can do a lot with one syringe. And you don't have to do everything the same day. You can always come back. You know, and if you want more volume. Sometimes first you're just building the structure, and then after that you're kind of adding more volume. So let's see, I'm gonna give her a little bit more on top here. So you want the upper lip to be about, if this is a ratio of 1, then you want the bottom lip to be about 1.6. So it should be slightly bigger than the upper lip. If you don't maintain that and you get one of the lips, you get the ratio off, it looks weird. So I'm gonna put a little pout here for her, but you always have to make sure you maintain that ratio or things start to look weird. So I've used about half the syringe. I'm gonna put a little bit more on her bottom. The other thing is there's normally a little divot here in between the lips, kind of right here, and you wanna respect that divot. If you fill across that and you get rid of that, then you start to look like a sausage duck lip, kind of. And you try to avoid that so that it doesn't look unnatural. So the other thing is I like to involve the client. So these are her lips, this is her face. She has to look at it all day long. So that might be a good point when I still have you know, quite a bit of it left to say, hey, how do you like it? How's it looking? What do you like? What do you want to see more of? And then I let them see what they like. And if they say, oh, I think it looks like it needs a little more on this side or it needs a little bit more on that side. Because again, I can use my artistic eye, but it's their lips. I want them to be happy with the results. So I get them involved and sometimes they say, I'm good, let's stop here. And we just stop. And we find a place to use the rest of it. And because they don't want it to be a super duper obvious change. They want it to just be subtle. And if this is your first time, like the first time I had mine done, I think I did that. I think I used about half a syringe and I was happy with that because it was so much different than what I was used to, but not different enough that everyone and their mother would like on the street would know I had my lips done. The important thing is knowing when to stop. And some of that's at my discretion just because I want everyone to have a really natural look. So if you're wanting these like Mick Jagger lips, I'm not probably the right doctor for you, but we really focus on natural looking injections, and we call these injectables, and so we say the best injectable is the least detectable. So I can't help the bruising if she gets that, but the rest of it I can help. So what do you think, Trace?
I love them.
Okay, and what happens is they're gonna be swollen for a couple days. You might be bruised if you bruise for a little bit and usually a makeup and lipstick, dark lipstick will cover it. We can also use our BBL machine and help with bruising. We can treat lips, and I've done that before, especially if